Welcome to your CFP exam prep session focusing on health insurance, specifically major medical coverage. Today, we're diving deep into how this essential insurance type works because it's frequently tested and often misunderstood by exam takers. Let's break down major medical insurance into its core components. Major medical insurance primarily covers two fundamental aspects. The first is hospitalization, which includes your room and board, nursing care, and other hospital services. The second is physician fees, covering the doctors who treat you during your hospital stay or office visits. Understanding how costs are shared between the insurance company and the policyholder is crucial for the exam. A common mistake students make is confusing the order of how expenses are paid. Here's how it actually works. First, you pay the deductible, which is the amount you must pay before insurance kicks in. For example, if your deductible is $2,000, you'll pay the first $2,000 of medical expenses out of pocket. After meeting your deductible, coinsurance begins. Many students get tripped up here thinking the insurance company pays everything after the deductible, but that's not the case. Coinsurance is the percentage split between you and the insurance company. A typical arrangement is 80-20, meaning the insurance company pays 80% and you pay 20%. For instance, if you have a $10,000 medical bill and have already met your $2,000 deductible, you would pay $1,600, 20% of $8,000, and the insurance company would pay $6,400, 80% of $8,000. The exam often includes questions about out-of-pocket maximums. This is the annual limit on your total spending, including deductibles and coinsurance. Once you hit this limit, the insurance company pays 100% of covered expenses for the rest of the year. Many test takers forget to include the deductible when calculating whether someone has reached their out-of-pocket maximum. Another frequently tested concept is the difference between in-network and out-of-network providers. Insurance companies negotiate lower rates with in-network providers, and your coinsurance percentage is typically more favorable when you stay in-network. The exam might present scenarios where you need to calculate costs for both in-network and out-of-network services. Here's a practical example that often appears on the exam. Let's say a client has a $1,500 deductible, 80-20 coinsurance, and a $5,000 out-of-pocket maximum. They receive a $20,000 medical bill. You'll need to calculate their total responsibility. First, they pay the $1,500 deductible. Then, they pay 20% of the remaining $18,500, which is $3,700. Their total would be $5,200, but since their out-of-pocket maximum is $5,000, that's all they would pay. The insurance company would cover the remaining $15,000. A final point to remember is that preventive care services are typically covered at 100% with no deductible or coinsurance under the Affordable Care Act. This is another detail that students often overlook when analyzing exam scenarios. Remember these key points about major medical insurance. Know the order of payment, starting with deductibles, then moving to coinsurance. Always consider the out-of-pocket maximum in your calculations. And don't forget about the differences between in-network and out-of-network coverage. These concepts will help you tackle even the trickiest insurance questions on your CFP exam.